Thank you.
What do you think are the biggest challenges facing the Philippines right now in the field of medicine?
Okay, it's the challenges in healthcare is really quite wide topic
Mm-hmm.
because it will entails a lot of aspect when we say challenges because
Mhm.
there's political will. You know, when we say political will, of course the budget comes from the government.
Right.
So if the government officials or the leaders of a town is not aware or not that the health programs is not part of his platform, then political will is not there.
Mm-hmm.
Hence, the budget will not be allocated to health.
Right.
And of course, there's also challenges in terms of the belief of the people.
Mm-hmm.
The other challenges comes from the people. The
Mhm.
belief that the medicine or the medical interventions are expensive.
Mm-hmm.
They should know that there's already there's a lot of financial support, but the problem is one of the I think this is the third problem. Most of the support is going to the cities, the urban,
Mm-hmm.
not much given to the rural.
Okay.
And of course, fourth uh, big challenge is the manpower
Right.
because the salary relatively, if you will be comparing it to outside the country, it's really low. So we're actually having a brain drain. Some
Mhm.
of the nurses, and not some but most of the nurses, they just go hospital for 2 years or 1 year and they fly out of the country to to have a greener pasture. You cannot
Right.
blame them.
No,
You cannot
because
blame
if
them.
you do the same education and work abroad and can make twice as much money and then
Yeah.
send the money back to your families, why I see no reason why people
Yeah.
wouldn't do that.
Not also to nurses but to doctors.
To doctors as well. And obviously the education here for your medical schools is top notch. So
Yeah.
there's
So you're gonna study for 10 years, and then
Mhm.
after studying 10 years, you have to go residency,
Mhm.
and then doing residency, the salary is really low.
Mhm.
And after, of course, your specialty, sometimes you are required to do some specialty. And some of people go to moonlighting, meaning doing having duty in the emergency room,
Right.
and the what do you call this? The salary or the compensation is really not that big.
Right,
Even
so
if you like do duty 24 hours every day, it
So
will
they're
not be
working
comparable.
so hard to try
Yeah,
and make
yeah,
it,
it will
to
not
try
be
and make
comparable
money.
to the other countries.
Right. I can totally understand that.
That's why I went to Singapore
Oh, hey, that's okay.
for 2 years. But
Hey, you make that
yeah,
money.
but I went back.
But you
Yeah,
came
I
back
returned.
home.
Yeah.
So a big problem is doctors need a higher income in order to
Yeah.
want to stay in the
Yeah.
Philippines because it takes so long to
Yeah.
achieve the qualifications in order to practice medicines.
Yeah, actually, in terms of qualifications, relatively to compare to other countries like Singapore,
Mm-hmm.
I think they only have 4 medical schools there.
Mm-hmm.
Indonesia also have less. Hence, some of the Indonesians wanted to study medicine. They go here. We have a lot of medical
Lots of colleges.
colleges here. Some of them they really don't require like university. High grades from your
Mhm.
previous university record. So the problem here is actually not the number of medical schools, or it's more of the opportunities and the salary.
Right.
Most of the doctors who graduated, most of the doctors are in the city. Only few are in the rural areas because, of course, in rural areas there's also much lesser pay compared,
Right. And the rural areas aren't as sought after by politicians either, so
Yes.
therefore the budget isn't being
Yeah,
allocated
and
to.
also very dangerous.
No,
I have
it's
I
dangerous.
I know a lot, I know some doctors who was killed in the province
Mm-hmm.
because of the I'm not sure who killed them. I don't want to say terrorists, or I don't know, but it's really also dangerous to because there's no CCTV there. It's the
Right.
farm, it's the mountains.
So it's not safe for doctors out. So
Yeah.
they're not being paid enough money. It's not
Yeah.
very safe. And then on top of that, the amount of time to become a doctor,
Yeah.
and then to risk your life. That's
Yeah.
that's
But
pretty
good
intimidating.
thing. I think the government is super good in doing what they call the DTTB program, Doctor to the Barrio.
Okay.
to the various programs. So we're in, they give scholarship to students, and as a return, this student, or I mean, if they already have the license, they are being sent to different provinces.
Yes, we have something similar,
Right.
but with education, and where I come from, it's Teach for America, where they say
Oh,
you go to school, we'll pay your school, but you
Yeah.
got to do 5 years out in
yeah,
East
exactly.
Ubangi.
I think 1:1.
Mm-hmm.
1:1. I mean, 1 year being a scholar. I'm not sure about this. I have to ask me.
Yeah, it sounds like a similar
Yeah, yeah,
program.
yeah.
Sounds like a similar program.
So those are the challenges.
Those are the challenges.